Hello, everyone. Welcome back to another weekly book review. And I'm still coming to you from my bedroom as I continue to heal from my ankle surgery. Today's book is by a physician, Dr. Hester, and it's titled Patient Empowerment. More than a book, it's an adventure. So, the first thing I want to tell you about this book is that Dr. Hester tells you that forget about the fact that she is a physician and think about just a friend having a conversation with you about how to have a more productive encounter with your physician or physicians. And so there's a couple of things that I want to highlight in the book. So number one, it's just 8 chapters, so it's a very easy read. I read it in one sitting, and there are 3 appendices: one for common medical tests, common medical abbreviations, and then a glossary of common medical terms. Now, I remember my grandparents saying, "Well, the doctor said it; it must be right, right?" And so I just noticed that my moo is the same color as the book. How cool is that? Anyway, back to business. So they used to always say, and even my grandfather, who was 103, still says today, well, the doctor said it, so it must be right. Well, the doctor can only help you based on the information that you provide. And so when you leave out of the visit, what you get is based on what they told you, they use their medical training. But what if you could come to the visit with more information? So there are 5 areas that I want to really talk about, and this is probably one of my favorites, and it's about seeing eye to eye with your doctor. And she really talks about how you could be more intentional about what you're going to share during the visit, right? Sometimes we think, oh, that's not important, but it could be that one little detail that changes the treatment plan, right? So she walks you through these questions that the doctor is going to ask you. And as a medical coder, certified medical coder, I knew all these things in the book. So it was just really cool to see it and know it. But she walks you through how, like, let's say you're going in for an acute visit, a problem that's happening right now. Be prepared to very clearly and concisely share the history of this present illness. History of present illness actually has 8 areas: location, duration, timing, quality, severity, all those things. She talks about it in the book. You can get it on Amazon. Okay. So um, she walks you through that. So that's my favorite, one of my favorite parts. Another part of the book, she very briefly goes into health insurance options and understanding the complex regulatory maze that I know as medical billing and reimbursement, but how to be more confident to ask the questions and understand what they're saying to you, right? She also talks about something that's also near and dear to my heart: medical records. If you don't have a personal medical record at your disposal for you and the loved ones that you are responsible for, that's your homework assignment. Why is that? In the case of an emergency, if you or those that you are responsible for cannot verbally give a history of your life from a medical perspective, the doctors are going based on what they see. But what if they knew about the surgeries? What if they knew about the family histories, right? So it's up to you to share those things with them, okay? So having a personal health record, PHR, very, very important. Um, somebody asked me, well, should I have it on paper? Well, what happens if you got a fire, right? So I personally believe in having it in an electronic format. I wouldn't necessarily pay for a software, but your doctors generally have a patient portal, And so I would be looking at like a patient portal to grab information and store electronically securely for yourself. She also talks about technology in healthcare, and I don't even know what number I'm on now, but one of the things that I experienced during the pandemic was that my mother, who was a senior citizen, was not able to attend a virtual visit because she didn't understand the technology. And by the time she contacted me, it was too late. They basically told her that she needed to reschedule the visit. So don't be afraid to ask for help when it comes to the technology in healthcare. I'm going to wrap this up by saying Dr. Hester is one of my guests on 52 Authors, 52 Weeks in December of this year. And I hope you will tune in. Don't forget, scan the QR code to get a copy of my book list. Bye bye now. See you next week.